Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will discuss liver cirrhosis and liver cell failure. Liver cirrhosis is a pathological term which means fibrosis and regenerative nodules which replaces the normal architecture of the liver and destroys the normal hepatocytes, and so the liver gradually loses its function. Causes of liver cirrhosis may include chronic viral hepatitis, chronic alcohol abuse or alcohol consumption, excessive alcohol consumption, drugs toxicity like isoniazid and methotrexate, autoimmune diseases like autoimmune hepatitis, primary sclerosing cholangitis, and primary biliary cirrhosis, metabolic liver diseases like hemochromatosis, which is the disease with excessive iron deposition in the liver, Wilson's disease, which is a disease with the excessive copper deposition in the liver. Number 3, glycogen storage diseases, and number 4, fat storage diseases. Clinically, cirrhosis is considered to progress through 3 stages. Compensated cirrhosis, this means the patient has cirrhosis but he has no manifestations of liver cell failure, and this could be discovered accidentally on doing abdominopelvic ultrasound. Compensated cirrhosis with variceal bleeding, this means the patient has no manifestations of liver cell failure but only have variceal bleeding or upper GIT bleeding or lower GIT bleeding due to presence of varices, whether esophageal varices or gastric varices. Number 3, decompensated cirrhosis together with manifestations of liver cell failure. Again, we have symptoms and signs. If the patient has the 3rd stage, which is decompensated, only this stage the patient has presence of complaints, whether due to complications or due to manifestations of liver cell failure. Okay. Like what? Like fatigue, disturbed sleep, muscle cramps, and weight loss. Number 2, anorexia, which may be associated with nausea and sometimes vomiting. Reduced muscle strength, exercise capacity. Also, the patient may complain from abdominal pain, which may be due to enlargement of the liver early, enlargement of the spleen due to portal hypertension, It may be due to abdominal enlargement due to the presence of ascites, and may be due to presence of infection as in case of spontaneous bacterial peritonitis. There is also menstrual abnormalities in females, which is usually in the form of amenorrhea. In males, there is erectile dysfunction, loss of libido, sterility, and gynecomastia, which means enlargement of the male breast. Hematemesis, which means vomiting of blood, is present in 15 to 25% of cases. Sometimes there is no hematemesis, but the presentation is melena. Melena means passage of black tear stool, which is due to passage of digested blood in the stool. This is when the amount of the blood or bleeding from the varices is not large enough to produce hematemesis, and it passes through the stool. Skin manifestations like spider nevi, which are angiomatous malformations, which are present in the distribution of the superior vena cava along the upper limbs, neck, and upper part of the chest. Palmar erythema, from its name, redness in the palm, on the thenar and hypothenar areas, and the Dupuytren's contraction. Also, the patient may be presented by jaundice, which means yellowish discoloration of the skin and the mucous membrane. And clinically, we can find yellow eye and yellow soft palate and yellow skin. Also, 70% of patients may have enlarged liver. This finding is present in the cases of compensated cirrhosis with or without variceal bleeding. In decompensated cirrhosis, never we can find enlarged liver. Why? Because in this stage, the liver usually shrunken and small in size. Splenomegaly means enlargement of the spleen, which is present in 35 to 50% of the patients. Also, there is dilated veins on the chest wall and on the abdomen. And there is evidence of vitamin deficiency, especially vitamin B12, folic acid deficiency, and sometimes vitamin deficiency, giving the special presentation in the form of cholecystitis and cheilitis. Ascites, which means presence of free fluid in the peritoneal cavity in the abdomen. Pleural effusion, which means the presence of free fluid in the pleural cavity. And peripheral edema, which means presence of bilateral lower limb edema, which is pitting. This all is due to decreased albumin synthesis, which is an important item or important protein which is sensitized by the liver. Ecchymosis, which means bluish discoloration of the skin, also occur in those patients. This may be due to deficiency of prothrombin, which is a very important coagulation factor, which is known as coagulation factor 2. It's very important for coagulation, and its deficiency leads to easy bruising and bleeding tendency. Encephalopathy means says mentally changes which occur in patients with liver cell failure due to affection of the brain by certain metabolites like ammonia, in which the patient is presented by tremors, disturbed consciousness, disturbed behavior, and even deep coma. It may be precipitated by diarrhea, hypokalemia, excessive protein intake. Number 15, fever. Fever is not a common finding in patients with liver cirrhosis. Anemia, laboratory finding, laboratory finding about the investigations for the patients with cirrhosis and liver cell failure we can do are CBC. CBC will show the following. Number one, anemia, presence of anemia. Which type of anemia? We may found all types of anemia. We may found microcytic hypochromic anemia due to iron deficiency, due to chronic blood loss, due to the presence of varices. Number two, we may found anemia of folic acid and vitamin B12 deficiency, which is called macrocytic hypochromic anemia. And we may found normochromic normocytic anemia, which is due to chronic disease, as cirrhosis and liver cell failure is a chronic disease, and there is an increase in certain cytokines which may lead to suppression of the bone marrow. Also, about the white blood cell count, it may be increased in cases of infection or may be decreased in cases of hypersplenism. Thrombocytopenia is also present or could be present due to presence of hypersplenism. What is the meaning of hypersplenism? From its name, hyper means increased. Splenism means activity of the spleen. So there is increase in the activity of the spleen in destructing blood. Another laboratory finding is the prolongation of the prothrombin time. As we discussed before, prothrombin is a protein which is a coagulation factor 2. It is sensitized in the liver, and when there is liver cell failure, there is prolongation of the prothrombin time. There is also elevation of the liver enzymes as AST and ALT, and this can occur early in the disease, in the acute phases. Later on, it is normal. Alkaline phosphatase may be increased, progressive elevation of bilirubin, and the decrease of the serum albumin. Gamma globulins are increased in cases of autoimmune hepatitis. There is increased risk of diabetes mellitus, especially in patients with hepatitis C virus infection, alcoholism, hemochromatosis, or NAFLD. NAFLD means increased fat deposition in the liver, which leads to fibrosis and cirrhosis. Imaging uses in the diagnosis of liver cell failure and liver cirrhosis. We could use abdominopelvic ultrasound, which may give us an idea about, number one, the size of the liver, the texture of the liver, if there is fibrosis or cirrhosis or cirrhotic nodules. Number three, it may give an account on the spleen size, and may give an account about the presence of free fluid in the abdomen, which is called ascites, and if this fluid is clear or turbid. Turbid is, this means infection, as in case of spontaneous bacterial peritonitis. Triphasic CT also could be used for diagnosis of hepatocellular We can also do liver biopsy for diagnosis of the pathological changes in the liver, and we may use the endoscopy, gastroesophageal endoscopy, which is used, or esophageogastric endoscopy, which is used to visualize the varices in the esophagus and in the stomach, or colonoscopy to detect any bleeding tendency in the. What about the complications of cirrhosis? It may lead to, number one, aporgite bleeding, which is presented by hematemesis or melena. It is due to bleeding from varices. Liver cell failure, which is very important, could be precipitated by diarrhea, precipitated by chest infection, precipitated by spontaneous bacterial peritonitis, precipitated by surgery, precipitated by hypokalemia, and the excessive tapping of the acidic fluid. Hepatorenal syndrome, which means renal impairment in a patient with liver cell failure. This is a very bad prognosis for the patients. Hepatopulmonary syndrome, which means pulmonary manifestations like cyanosis in cases of liver cell failure due to opening of the portosystemic shunts in the lung. Encephalopathy, which is discussed before, and increased risk of hepatocellular carcinoma. Also, many patients may complicate by osteoporosis. How to treat liver cirrhosis and liver cell failure? Number one, management of the cause if possible. Prevent liver cirrhosis before its occurrence. Like what? Like stop alcohol, like treat and diagnose, early diagnosis and the treatment of and the prevention before all of the viral hepatitis C and hepatitis B, and metabolic disease, early diagnosis and management of it, etc. Number two, diet. The diet have to be small, frequent diets, not rich in protein to avoid the occurrence of encephalopathy, and give electrolyte, which is that maybe decreased like potassium. Also, the diet we must we have to restrict sodium in patients with fluid retention, and we have to give the patient plenty of vitamins, plenty of fluids, and branched chain amino acids could be given to the patient as a replacement for in cases of encephalopathy. Lastly, the main treatment or main management of liver cell failure is liver transplant. Another item in the treatment is treatment of complications, like treatment of ascites by aspiration of the acidic fluid, by intravenous albumin and plasma transfusion, and by giving diuretics to the patient. Treatment of hepatorenal syndrome by giving intravenous fluids, by giving the patient intravenous vasopressin, intravenous plasma, and albumin. treatment of encephalopathy by admission of the patient, giving the patient enema, frequent enemas to remove all the intestinal contents and to decrease the absorption of ammonia, which is the main factor in occurrence of encephalopathy, and prevent protein diet, treatment of hypokalemia, and replacement of with intravenous albumin and plasma, and giving the patient lactulose. Spontaneous bacterial peritonitis could be treated by a specific antibiotic and according to culture and sensitivity, and treatment of bleeding by doing upper GIT endoscopy and injection sclerotherapy or band ligation of the Prognosis. The prognostic scoring system of the cirrhosis includes what's called child book classification and Meldes score. Patient with Meldes score more than 14 required liver transplantation. Only 50% of patients with severe hepatic dysfunction, which means serum albumin less than 3 grams per deciliter, bilirubin more than 3 milligram per deciliter, ascites, the presence of ascites, the presence of cachexia, the presence of encephalopathy, and the presence of upper GIT bleeding survive 6 months without transplantation. So those patients, transplantation is mandatory in them. Renal failure or occurrence of hepatorenal syndrome increases mortality in those patients. Obesity and diabetes increases the risk for clinical deterioration and mortality. Patients with cirrhosis are at high risk for developing hepatocellular carcinoma, especially patients have cirrhosis due to alcohol and viral hepatitis.